Hi guys, my name is Dr. Vikas Rastogi and I am doing MD Radio Diagnosis from Nair Hospital, Mumbai. So I am here again to teach you, to guide you how you should prepare for this DNB June exam, which is like 15 to 20 days away. So in these 15 to 20 days, what should you do to crack this exam, and how can you get a good rank in this exam? The first thing is MCQs. If you haven't solved MCQs in the past, or if you are solving MCQs in the past, then you should again start solving MCQs. That is online, not offline, because when you solve MCQs online, when you give test series online, then you realize that there is a difference of environment in the offline and the online thing. One is it will help you in the exam center because you have practiced a lot online exam at your hostel or home, wherever you stay, so that it will help you in the exam center. How? You will not feel any difference in the exam, and you will not feel any difference while solving the MCQs. You will be feeling like home, and you will be feeling like adapting to the computer screen. But if you are not solving MCQs online, then it will create disturbance. It will stop your thinking process. It will halt your thinking process. It may block you at some good questions which you already know. So I prefer to say that you should solve MCQs in these 15 to 20 days, at least two test paper every day, and that is online only, not offline. Second thing is revision. Revision is must in these 15 to 20 days. Major subject you should give 1 day. Suppose you take pathology. In pathology, you don't read the whole book. You have read the guidebook, Devesh Mishra or Arvind Arora, or you have read notes. Doesn't matter. But you should not read the whole thing again. Obviously, if you are reading notes, then you can read the whole thing again in 1 day. But if you are reading guidebook, then you cannot read the whole thing again in 1 day. So what you should do, you should only and only read the highlighted text. If you are reading Arvind Arora, then the one-liner is given at the end of every chapter. You should read all the one-liners. If you are reading Devesh Mishra, then it is easy to revise because the text highlighted, because the text are already in bold, which is important. So you should think like a smart boy. You should think like that I cannot read the whole book in 1 or 2 days. I should revise and I should grasp maximum in least possible time. So what you should do, you should focus on the highlighted text only, which is important. What you feel is important, you should revise that only, which you tends to forget. And for subjects like pharmacology, obviously you should revise as much as you can. The least toxic, most toxic, most common side effect, antimicrobials of choice, drug of choice, everything you should revise. One-liners, most of the one-liners you should focus. You should focus on mostly one-liners. And for short subjects, I will say that you should revise one short subjects in half day. Like if you are revising skin, then it should be completed from 8 AM to 4 PM, and then 4 PM to 10 PM you can revise another subject. However, it is not possible to revise 2 subjects in 1 day, but if you are sitting continuously, if you are dedicated, then it is possible. I have done it, many have done it, and you can also do that. So revise skin, in skin or psychiatry, anesthesia and radio, revise mostly one-liners. Don't revise the concepts, don't read the whole book. Revise maximum one-liners, practice MCQ online, give subject-wise test or grand test, doesn't matter. So this is about revision. You should revise 1 subject major in 1 day and 2 minor subject in 1 day. So you will be able to revise the whole subject in 15 to 20 days. All syllabus in 15 to 20 days. That will help you also. And last thing I want to say is you should be focused on. If you are thinking that I will prepare for NEET, I will prepare I'll not prepare for this DNB. If you are thinking of giving up for this exam, then this is not the mentality to crack any exam. You should only and only think that this is your final exam, and you will have to crack this exam at any cost. Okay, but don't think about the result. It will be good or it will be bad. If you have worked hard, it will be good. Otherwise, it will be up to your hard work. So, and one last thing I want to say for DNB June exam: image-based question, because the pattern is changing every year. So you should focus on image-based question in in radiology and in skin. In radiology, mostly they will ask you about image-based question. They will not ask you theory questions. And in skin also, they will give you image, but they will give you history, they will give you sign, so you will be able to recall, and you will be able to solve MCQ even without looking at the images. This is what happens in the NEET exam. They provide you many more information so that you can solve MCQ very easily. They just try to confuse you with the pictures. So focus on radiology images, especially anatomical images of radiology, like chest anatomy, like limb anatomy. So you should focus on that. CT ka anatomy, chest ka, it is like that. So, and about ECGs, I don't think if you have read ECGs before, then it is mandatory to revise, because फिर पहले पढ़ने का फायदा ही नहीं हुआ ना. And if you have not read ECG before, then it is not the right time to read ECG before the DNB exam, because they will not be asking you ECG. I don't think they will be asking you ECG. Okay, so all the best, guys. If you have any doubt, please leave in the comments. I will make another video on your doubts, and I will be able to solve. I hope that I will be able to solve your doubts. I was very busy actually in these last days, so I didn't upload any videos. But after this DNB July exam, I will be uploading more videos regarding how to go for each subject and how, like, many more things. Okay, guys, all the best.